thank you for inviting me for the annual report, which we began many years ago. We make a combined effort now. Jim Donmoyer, who will be expounding upon the drug deaths. Holly Leahy will be talking about the suicides, and Bob Dowd will be talking about, we have a close association now. He'll be explaining how the coroner's office and his office are combining efforts to help with transportation and some other issues. So we're going to make it a combined effort, if that's okay.
Do you want to introduce your bodyguard now?
Oh, yeah. And my one deputy named Doug Libby. He's been with me. Doug, when did you start?
99.
99. So he's put up with me for all those years.
Appreciate your work, Doug.
Yeah.
Okay.
And before I start, I want to talk about how important the relationships that the coroner's office has with the people that I just introduced. I mean, we're in close contact on a regular basis. I notify them of everything that's happening in their field, and my appreciation goes out to my deputies, because when they get that call from me at 2 o'clock in the morning to go out to take care of things, they're Johnny on the spot, and they just do a tremendous job. And thanks for the county support through the years, and this year, especially with COVID and how COVID affected the past 2 years. This year, COVID pretty well, coroner-wise, is pretty well non-existent. The hospital now is not reporting any COVID deaths to us because they're really just few and far between. So we're getting back to normal this year with COVID deaths, and we're getting back to the normal deaths that we've had through the years.
Do you take questions as you go?
Sure, go ahead.
Okay, I'm reading the opposite in the papers. There's 100 deaths a day in Pennsylvania or something like that?
Not in Lebanon County.
Interesting.
Yeah. Okay, following the report of the year 2022 from the Lebanon County Coroner's Office. We had 855 cremations that we took care of. Total deaths that we investigated were 375. Natural deaths that we investigated were, out of the 375, we had 370 natural deaths. Accidental deaths, we had 45. Of those, 29 were drug-related, which I said Jim will expound upon. We had 7 motor vehicle deaths we investigated, 1 motor vehicle pedestrian death, 3 deaths resulting from falls. We had 1 sudden unexpected infant death. We had 1 case of hypothermia, 1 case of asphyxia, 1 case of multiple blunt force trauma, which was, I'll just tell you now, was caused by a bull attack. We had 1 chop wound to the head. Then going on to suicides, we had 20 cases. And again, the most common cause of death was by gunshot. 12 cases were from gunshot wounds. 5 cases were overdose. We had 1 by hanging, 1 laceration of the wrist, and 1 train incident. Then we had 3 cases of homicides, and right now there's one case pending. Just to give you an idea, talking about COVID deaths and how that affected the office. 2019, we investigated 329 deaths. The following year, because of COVID, 2019, that was 329. 2020 was the first year for COVID. We had 526 cases. And 2021, we had 498. Now we're getting back, as I said, this year, we had 376 cases. Going back to a normal year, 2019, 329. So you can see the numbers are up, but not as they were with COVID. So, and we were just talking out in the hallway, I think we're going to see these pretty high numbers the baby boomer generation is coming of age now. So I think we're going to see more natural deaths that we're going to be investigating because of, we're getting older.
Donmoyer's looking at me, yeah.
You looked at me, I looked at you. I don't know.
I knew what you were thinking.
I don't know if I'm a baby boomer or not. I hope not. I'm like,
I have a serious question.
Uh-huh.
Oh,
Total deaths, 375, but cremations, 855.
Mm-hmm.
How can you have more cremations than deaths?
Because we talked about this through the years. The coroner's office is in charge of investigating anybody who's going to be cremated. So the funeral homes call us. They have a cremation case. We investigate that case to make sure there's nothing suspicious that we would have to investigate. So the cremations really are a separate part of investigations. That's a total separate issue.
and other natural deaths would not be on this list either.
Right.
Yeah, so I mean, there's a whole other category that, these are just the ones that you have to track
Right.
through your coroner's office.
Right.
Yes.
It still doesn't make sense to me. I don't see how you double the numbers if you're reporting all deaths.
The cremations are a separate entity. They are not counted into the total deaths.
So, in other words, the true total deaths would be 855 plus 375?
Yeah, correct.
Oh, that would make it more clear to
Yeah,
me
yeah.
if that
Yeah,
number was.
those that we investigate, all those cases, yes.
All right.
Correct. Yep.
Thank you.
Any other trending that you see, Dr. Yocum, or it was?
Well, they're going to be talking about some trends. I'd rather not, I don't want to steal their thunder,
It's okay.
you know.
You
I
let
could
me-
talk about it, but Jim told me when we came in that he'd rather, he'd talk about it.
I don't have thunder, but
All right, well,
my
whoever's
turn?
next.
Yeah, you'll see some trends, which are good trends. Jim?
okay. Good morning again. My name's Jim Donmoyer. I'm the Executive Director of Lebanon County Commission on Drug and Alcohol Abuse. I'm here today to speak of overdose deaths in Lebanon County. First off, I want to give a historical perspective so you understand where we were and where we are now. In 2020, in Lebanon County, we had 39 overdose deaths, which was the most ever in Lebanon County. In 2021, we had 31 overdose deaths, which was a 20% decrease in deaths. And in 2022, as Dr. Yocum earlier stated, we had a total of 29 overdose deaths, which is 6.4% decrease. So since 2020, we've decreased the overdose deaths in Lebanon County about 27%. Speaking of 2022, I want to break down some data, some statistics, so to speak. Out of those 29 overdose deaths, the gender, there was 18 males and 11 females. The age of these individuals, the oldest person was 84 years of age. The youngest person was 19 years of age, for an average age of 44.5 years of age. Race breakdown, there was 22 Caucasian individuals, there were 6 Hispanic, and there was 1 that was considered unknown. We also break down the deaths by months, so we get some idea of which months we had more overdose deaths than others. In January of 2022, we didn't have any, we had 0. February, we had 3. March was the highest month, we had 7. April, we had 2. May, we had 6. June, we had 2. July, we had 2. August, we had 0. September, we had 3. October, we had 2. And November, we had 1. December, we had 1, for a total of 29. We also, when we look at the overdose deaths in Lebanon County, we also break it down. It was a suggestion years ago, I don't know who brought this up, but there was a question of where exactly are these deaths happening in Lebanon County, so we can focus in on those areas, perhaps. So we break it down, the deaths by zip codes. The 17046, which is North City and North County, is 11 total. The 17042, which is the south side of Lebanon and the south side of the county, 13. 17078 was Palmyra, we had 3. And in Myerstown, 17067, we had 2, for the total of 29. This year, we didn't have any in Jonestown. We didn't have any in Fredericksburg, Annville, Richland, Newmanstown. And I think last year when I reported this, I think it was kind of every municipality had at least one, I believe. So it's really concentrated in 4 distinct areas, really 2, the 17046 and 17042. Out of those 29 people, 27 were actually Lebanon County residents. 2 were non-county residents. 1 was from the Bronx, New York, and 1 was from Fredericksburg, Virginia. Out of the 29 overdose deaths, 16 of the 29 involved fentanyl. Fentanyl is a drug that we see quite often in these overdose deaths.
Was that usually mixed with?
Well, it's
Yeah.
it's a mix.
Yeah.
We call it mixology, but
Yeah.
the
It's
mixture
a-
of fentanyl and
Right.
with other drugs, whether it be someone thinks they're
So
smoking
somebody may buy it and not
marijuana.
really know what the weight
Correct.
of that part is.
It's heroin mixed with fentanyl. It's marijuana mixed with fentanyl.
They have no idea what they're buying.
So 16 out of 29 this past year, which is 55%. And I look back at last year, I think it was close to 80% fentanyl was involved in the deaths
Is
last
that
year.
also mixed in with like the liquid products that they vape?
It can be, yeah.
Oh, really?
It can be.
I wonder.
We were talking out in the hallway. Just like I have my certification in addiction medicine, and I give a talk to the district attorney's group. When we look at marijuana, years ago, you buy marijuana, you smoke a joint, no problem, you're smoking marijuana. Today, you don't know what that marijuana has been dipped in. We've had several deaths through the last couple of years of people smoking marijuana who died of a fentanyl overdose.
That's scary.
Yeah.
And that's the same with vape. You don't know actually what
What's in it?
exactly is in the vape.
Any questions for Jim?
If they're going
I-
to these dispensaries, is there a guarantee there's no fentanyl in it?
Well, yes. I've heard people that I've dealt with in our office who use drugs and get drugs on the street are now turning to the
Dispensary.
dispensaries because they know it's not, the street drugs is dangerous, it's not pure, they're not getting what they think they're getting, but at the dispensary, they're getting
Yeah,
exactly what
regulated, yeah.
Yep, right.
they're getting exactly
They
what.
know they're getting the real thing.
So people are starting to take the attitude, I get my car and I'll go there, I'm not gonna buy my drugs on the street.
Dr. Yocum or Jim, one of you, I've wondered this for the longest time, like with fentanyl. If I'm looking at it, if I'm a drug dealer and I'm looking to stay in business, why am I going to sell a product that one use is going to kill my customer? I cannot wrap my head around that.
That's part of addiction. I can tell you, years ago, when we used to find bags of marijuana, not marijuana, of heroin at the scene, we would never release what the bag looked like because people who have a drug addiction look for stuff that they know is powerful, and that's going to give them a high that they might never have had before. So you have to be an addict to really know why, number one, why you're looking for that. And so the drug dealers try to give something that's going to give them a high that they've never experienced before.
I think I
Well,
learned that also. Oh, good.
But, and the other thing to think about is even the drug dealers who's selling it to the people on the street, they don't necessarily know they're cutting it with fentanyl. They're getting it from somewhere else. So like our dealers in Lebanon, whoever's dealing heroin in Lebanon, 9 out of 10 times they're getting it from somewhere. They might not even know there's fentanyl in it,
Wow,
But
and they're
was,
selling it.
You know, one of the things we
The
learned
people
was
that are getting rich know it.
that's
that,
scary.
that if 3 people are involved as a group and one of them dies, you think, oh, that'll wake them up because they're not going to want to die. But no, they want to chase that next higher hit. And that was like shocking to me. You can't apply logic to this stuff because the addiction issue.
Nope.
But is there any, I mean, I'm just fascinated by this. Are there any drug dealers that are careful with how much fentanyl they're cutting into the other product?
I can't answer that. I don't know.
I
So
can't
it's really-
speak for that.
Yeah, so it's really like it's totally a crapshoot.
Roulette
Totally,
wheel,
yeah. Yeah.
Jim?
So you in a roundabout way saying that the fact that there is legal dispensed marijuana in the state of Pennsylvania, that's led to fewer marijuana deaths?
No, I'm not saying that at all. I'm saying people have said to me, instead of getting my marijuana on the street, I'll go to the dispensary to get it. I didn't relate that in any way to death.
But if they know it's not cut with fentanyl, because they're going to a legal dispensary. that's
Well, if
run
they
by
know it's not cut
Congress.
with fentanyl, that could be a reason why they're not buying on the street laced with fentanyl and maybe dying. I mean, there's a lot of reasons why our numbers are down. And I can't give you every reason. I have a few that our office would hope to think is the reason. One of the things that we do as an office, me personally, I'm the CCE of Lebanon County. Basically what that means is I get Narcan from the state, and I distribute Narcan in our community to whoever wants it. We give it to agencies, providers, we give it to school districts. All the school districts in Lebanon County have it. So I believe the use of Narcan has cut down on the number of deaths, for sure.
Right.
You know, and there's other factors. I mean, we have a very active heroin task force here in Lebanon County. They do a lot of events, they do a lot of things in the community, as far as education, as far as awareness. They put on events. They actually give out Narcan at their events as well. So, there's a grassroots part of it, and there's also a, scientific part of it where we're providing Narcan. Last year in 2022, we distributed 84 cases, which comes out to be 1,032 kids across the county. We anticipate, I'm thinking that has something to do with our numbers going down, I would hope. The other thing, in the future, my office, again, as the CCE, I'm going to be able to distribute fentanyl test strips. Fentanyl test strips in the past were, according to the law, were considered paraphernalia. So people couldn't possess them, because if you did, you'd get arrested. It's against the law. And the legislators just passed 200 to 1 that, they reversed that. Now they don't consider it paraphernalia. You are allowed to possess fentanyl test strips. I will have those in my office, and I'll provide those to anybody who wants them. Again, that will help. If you're getting drugs, you can test your drugs before you use them. If there's fentanyl in it, the test strip will tell you there's fentanyl in it.
Every little bit helps, yeah.
So those kind of things,
One more.
I know for a fact help.
But to kind of piggyback on what Laura was saying, I could see where they would cut fentanyl with heroin because it's processed.
Mhm.
But marijuana is grown and then cut, and it's not necessarily processed. Are they putting fentanyl on marijuana to raise the addiction levels so that they have repeat customers, or customers who need that higher fix? I mean, what is your evidence telling you? Like, I can't see the logic behind putting fentanyl into marijuana unless you're trying to create a
A
greater
bigger
addiction.
addiction.
Is that what's happening?
Yeah, I don't know what their motivation is, sir. I can't speak for that. That makes, to me, logical sense.
It's certainly possible.
They usually dip the marijuana in a substance.
Right.
And, it's not always fentanyl, it can be other things. I heard it, that embalming fluid. You ever heard that?
Jim, when will you have the fentanyl strips?
It was passed, and I'm waiting for, PCCD supplies them to me.
Oh.
So as soon as they make all those arrangements with the state, and get them out to us. So I'm anticipating in the next month, maybe, I would hope,
Okay. Like
as
to
soon as possible.
Move on to,
Oh, I'm sorry.
no,
You have a question from the middle,
oh,
over here.
go ahead,
Matt.
Matt.
I wanted to ask, have you seen an increase in Narcan distribution, the more we see how it affects?
2022, like I said, we distributed 1,032 kits. The year before, we distributed about 844. So there is an increase with people wanting the Narcan kits.
Okay, thank you.
Good morning. So my name is Holly Leahy, Administrator for Lebanon County Mental Health Intellectual Disabilities Early Intervention Program. So I also have some data, statistics for you with regard to completed suicides in Lebanon County. I'll start with a little historical overview of the numbers. So dating back to 2013, we had 26 individuals that completed suicide that year. That was actually the highest since 2013. If we look toward 2015, we had the lowest at 13. And then ever since 2016, there were 20, and then moving forward through 2022, where we had 20. We've had anywhere between 18 to 21 during those years, each year. So we've been fairly consistent over the last 6 years with regard to completed suicides. If we look specifically at 2022, we did have 20. That was 12 males and 8 females. The average age was 51.4, and so if we look, the eldest was 92, and the youngest was 19. As Dr. Yocum said, the highest method was by firearm. There were 12. There were 3 veterans. And then looking at if they had a mental health history, there were 9 out of the 20. And then if they were known to our agency, to MHIDEI, there were 2 out of the 20. If they had a known drug or alcohol history, there were 3 individuals. Then there were 19 Caucasian and 1 African American. And again, if we look at the place where they completed, there were 12 in Lebanon. So between that 17042 and 17046. But we did have several individuals that were not from Lebanon County. We had 2 that were from another county in Pennsylvania. And then we also had 1 individual from Fredericksburg, Virginia, interestingly enough. If we look at the months of completion, the highest in March we had 4, October there were 4, September 3, and November 3. So those were definitely our highest months of completion during those months of the year. If I turn aggregate information for crisis intervention, on average, we have 274 visits to crisis intervention per month. That's an average. And then on average, 200 individuals are actually visiting. So 274 visits, but that's actually only 200 individuals. Out of those 200 individuals, on average, we have about 65 each month who are presenting with suicidal ideation. So we actually have quite a large number of individuals presenting at crisis intervention with that suicidal ideation. But I think it speaks then to the system in whole and all of the services and supports that individuals are receiving so that they do not complete. So obviously if we look at those number of individuals, we could have a much higher number of completion per year. So it is really remarkable and speaks to all the individuals in the system that are caring for those individuals who are really having thoughts of suicide each month. There is much going on with regard to suicide prevention. Each year we do have an annual media campaign that is ongoing partnership with WellSpan Philhaven. That's a combination of social media, online newspapers, digital bulletins. We also have logos, magazine, and then on the merchandiser. So we really try to get out into the community. And then there are community trainings that are ongoing throughout the year, available to everyone in the community. And those are, again, available through WellSpan Philhaven. It's a combination of mental health first aid training, QPR, which is question, persuade, refer, suicide prevention training, and then Trauma 101. We do have a significant number of individuals in our community who have experienced trauma, and it's really important to understand how trauma affects individuals and how they respond to you each and every day. You can search on the wellspanphilhaven.org site for those trainings and sign up for those individually. And then we also have our Suicide Prevention Task Force, who meets the 4th Tuesday of each month. And there's much happening with that. We are currently working on May, which is Mental Health Awareness Month. We're working on a date in May 20th, for an awareness event where we will have vendors, activities, food, and a coordinated walk for individuals to really understand how mental health really is affecting our community and individuals in our community. Then we're also working on September, Suicide Prevention Month. We're creating that schedule of events. And we're making a little bit of change with regard to the remembrance ceremony. Typically in September, we have the remembrance ceremony at the garden, at the Stavers Dam barn. But this year, we have decided to move that to December and have more of a ceremony in December. So our office is working on that date and the specifics. So I would say stay tuned for more information with regard to that. Or if you'd like to know anything with regard to what is happening, you can call our office, and we'd be more than happy to share. So there's a lot of initiatives and a lot of things that are happening each and every month for suicide prevention. Again, if you'd like specifics or more information, please feel free to call me or any one of the staff at MHIDEI.
Just, and my recollection may be faulty, but it seems like the female percentage has really spiked.
Yes, absolutely. I'm sorry, I didn't note that. So, yes, it is unusually high to have 8 females. Typically, on average, we have maybe 2 or 3 individuals that are female per year. That number for females are definitely spiking, and the method that the females are completing is also spiking more with firearm, which is highly unusual for females as well. So yes, the statistics and the data overall is really seems to be shifting and changing. It is really important for us to have that data from Dr. Yocum and to have that relationship, which is really driving our efforts for suicide prevention each and every year, because understanding that the data is not remaining constant. Previously it was always, white males, middle-aged, by firearm. That is definitely shifting.
So when we get these cases, we provide all that information that she gave you that they can follow.
Any questions for Holly? Anything else?
Can Bob just say 1 or 2 words?
Certainly.
2020 was when we started doing transports for the coroner's office. The reason for that transition, just kind of a refresh, was that ambulances in the county were already stretched thin, and they were doing these, and we needed to find a way to better utilize our public safety resources. So we've taken over that logistical piece for the coroner's office. This year, 2023, we added 6 additional occasional staff to help complete this task. It's a program that continues to grow, a relationship that's working well, and I think it's a good thing for everybody. It provides a good service to the community.
And I have to compliment my office staff. My office staff, 6 of them?
Mm-hmm.
6 of them stepped up to the plate to participate in the transportation on-call schedule.
Wow.
So besides their work in the office, when they get done at night, they sign up for the on-call schedule to help transport bodies.
Yeah, the truck requires 2 people to be on call 24 hours a day, 7 days a week. These are people that have other jobs. We're only paying them when they go to a call. We're asking a lot because they're committing their time to be available for that response, whether or not there's a call. And you can't thank them enough for what they're doing for us.
I appreciate the interaction and cooperation.
Yeah. Really, I have to stress again, the cooperation that everybody in the county here provides to my office is beyond what I can, say to thank everybody in the county who really helps our office, and I really have never had any issues of getting participation or cooperation. I mean, thank you for everything.
Anything else, Bob? I just want to see if he's finished.
Yes,
Okay.
I have a question of Bob.
Yeah, I just want to know if
Okay.
he was finished with his.
I was wondering, and I know this isn't directly related, but I want to take advantage of the fact that you're here. I've had somebody ask me where they can get free test kits in the county these days. Do you have any idea if there are any
COVID
available?
test kits? For, at least for the time being, I know it's coming to an end, you can go to pharmacies and get them under your health insurance, and then the federal program is still available through the USPS. So those two avenues are
Okay,
available.
I directed them to a pharmacy, and they were saying they had to pay for them there, but really,
they
if they
don't-
have insurance, the insurance should be paying for them.
Most insurances are still covering it. You have to check with your individual provider, and I'm sure
Okay.
that is going to sunset at some point.
Right, and I know it's ending in May 11th or something like that, but I just wanted to see if you had any more information.
If they go to the USPS website, you can, there's an allotment that gets refreshed every so often, and you can apply for that. They ship them right to you.
Ship them to your house?
Yep.
Okay. Just double checking what has changed. Thank you.
And if someone does test positive, there are CDC guidelines to follow? Is that
Yes. Yep.
Still,
Is it 5 days, and then 5 days masking?
I believe that's
Quarantine and then
correct.
masking? That's what I was told.
Yeah.
I want to make sure I followed the rules.
I don't, and you'll have to excuse me, I have not looked at it recently, but last I looked, it was 5 and 5.
5 and 5, yeah.
But always check the most current guidance on their website.
Okay, thank you.
anything else before?
A note to thank you. We had another deputy join the force. Her name is Jody Mangren. She went through the coroner's course, which you helped pay for, thank you. That's a 1-week course that they have to take before they become fully certified deputies. We will be having another person participate, hopefully, in the near future, so we'll add another deputy to the force.
And Doug, do you have anything from your end?
No, not at this.
You want to add?
Thank you for asking.
Okay. All right.
I do
Yes.
have one more question for Dr. Yocum. I know there for a while we had had to get up to date at the Prothonotary's office. Are all the records that are supposed to be filed there now?
Every one of my records is in their office,
Every one of your records is in their office?
from the time I took office, correct,
Up to date?
correct.
Okay. And that's effective,
Correct?
Correct.
Thank you.
when did they get there?
This has been happening over the past several months.
Okay. I'm sensing there's more to the story, that's why I'm asking.
They're all there.
Okay, thank you.
Mhm.
Okay, anything else for the good? I know Dr. Yocum, you graduated from Lebanon, and we forgot to mention Lebanon girls are 24-0,
I know, he's great.
and they play tonight.